And that's the key, and we'll show
Yeah.
that with the research,
Yeah.
because part of this seminar I went to was about healthy aging.
Yeah,
They
that's a
talked
big
a lot,
one out
right?
there.
And
Yeah.
our research with Dr. Kenneth Stevenson showed how adding BioTouch, well, let's just show
It's
it now.
just that.
Yeah,
That's
and so
exactly
here's
what it
all these
does.
things in this chronic stress chart. You can see all the things outside. Those are the things affecting us, and we're interacting with them, and it's creating that individual. Just because you have, let's say, prostate cancer, it's being held differently.
Yeah.
Or you have atrial fibrillation,
Yeah.
it's being held differently. You might know it, you might not, but all these things are affecting us. Tobacco, relationships, the environment, diet, drugs, the genes. There again, it's just
There it
part of the
is.
stress cycle.
Right.
Psychological stress, emotional stress, childhood traumas that we might even not know about, socioeconomic status, politics, all these kinds of things. We're on a global media thing going on now. You open up your phone and you're across the world watching, the annihilation
This
of
is
peoples.
it.
Yeah.
Yeah.
Wars going on. And so that creates that chronic stress, which creates immune dysregulation, cortisol dysregulation, and then moves into the diseases we have: dementia, cardiovascular disease, infection, benign tumors, mood disorders, obesity. But every one of those, if you put 4 people together with a cardiovascular disease, they were showing on these charts, when you really check out the DNA and the genes, and there's all these machines now, 4 people with cardiovascular disease have a whole different design of their DNA.
Yes.
Whole different design. And so this medication might not work with that person, or this herb might not work with that person.
Right.
Then
And that's what I was talking about earlier. We all have a heart.
Right.
We all have a circulatory system, right? But every one of those 4 people are going to experience in that body a diversity. That's the
Yes.
diversity. So it's amazing.
And so what's nice about that is, before it gets to that point, you see there, we add BioTouch into this chronic stress cycle, equally for everybody.
Right.
And so then what you see is BioTouch improves the circadian pattern of cortisol release, which improves your quality of life. And it increases what's called interleukin 12 to improve immune system functioning, which increases the activity of genes that fight infection and cancer and promote healthy aging.
There it is.
Then if you have any of these diseases, your body, you're going to know what to do as you work with that clinician who knows, maybe a little more than you do, and hopefully so.
Yeah, hopefully so.